Okay, so the last disorder I want to talk about from the somatic symptom disorder category is factitious disorder. So in factitious disorder, the person's actually it's different with all the other disorders, somatic symptom disorder, conversion disorder, and illness anxiety disorder. The person isn't making up their condition or their symptoms. They're just really focused in on them and they're kind of blowing them out of proportion. Or with conversion disorder, they're they actually are fully convinced that they have this problem. So with factitious disorder, it's a little bit different because the person is knowingly creating their symptoms. And the real key aspect to factitious disorder is that they're creating these symptoms. They're producing these symptoms in order to receive the benefit of the role that they receive at being sick. So we call it the sick role. If you've ever, well, I guess as kids, you probably have had that experience where your parent takes such good care of you when you're sick. They cater to your every need, and that's kind of what they're experiencing when they are manifesting symptoms. They get more concern from people. People are like really interested. How are you doing? How are those symptoms? How are you managing it all? Right? There's even this perception that you're like a survivor or a hero because you're dealing with so much when you're going through an illness. And that seems to be what is most attractive to people with factitious disorder. They want those perceptions by others. They want that concern and care. And they might even go as far as to alter their physiology to simulate real illness. So they might, inject things into themselves. They might, they might do things to cause themselves to vomit, all with the purpose of trying to get others to show care for them. So the key thing, the key distinction with factitious disorder. So first off, of course, that it's being produced, right? They're either manifesting these symptoms or they're lying about the symptoms, and they're creating the perception that they're ill, but they know that they're not ill. But one key distinction is, okay, it's not about tangible external rewards. So it's not about, for instance, a workers' compensation case. So sometimes people will try to deceive and fraudulently try to receive some sort of benefit from an illness. So they might get into a car accident and claim permanent injury or illness, permanent disability. And that is done, not because they want to be cared for by other people, but because they want to make a lot of money out of the case. So we call that malingering. Malingering is producing or exaggerating physical symptoms to achieve external incentives. So again, maybe it's avoiding work, workers' compensation, military service, or even trying to evade criminal prosecution. Okay, so that's a little different. Here again, factitious disorder is about the role that they play. Now, that's a little bit controversial. So there's this question that maybe you should be asking is, why is factitious disorder a mental disorder as opposed to malingering, which is just seen as outright lying and not a mental disorder? Okay, of course, there's a difference there. The primary rewards versus secondary rewards or secondary gain, primary gain and secondary gain. So primary gain, again, there's something very tangible, physical that they're getting out of it. And factitious disorder, it's not about that. It's about that secondary gain. But why does that matter? Of course, there is a difference there, but why does that matter in terms of diagnosing this as a mental disorder? Why can't we, or why shouldn't we diagnose malingering as a mental disorder? So that's a key question. I guess I'm not enough of an expert to know the full perception, but there's actually a history of this being seen as a psychiatric condition. And I think that history is why, it's in DSM-5. Okay, now in terms of epidemiology, the prevalence, it's not really well established. The book says about 0.5%. However, the book is not really confident in that number. And so, so we don't exactly know how often this occurs. Now, there's another related condition to be aware of, and that's factitious disorder imposed on another. And it's also sometimes referred to, the older term for it is Munchausen syndrome by proxy. So this is where a person, we said that generally it's about making it seem like you are ill. Factitious disorder imposed on another is where you make another person appear to be ill, and that you do that for that gain of respect, or wow, you're such a good caregiver, you do so much for your child, and so it's a dangerous variant where they could actually sometimes put their child's life and health at risk in order to produce the symptoms that they're trying to portray that child to be having. And so they might cause that child to vomit. They might, give them toxins, things that can cause cancer. And unfortunately, this is a form of child abuse. So we should call that out for what it is. And so usually, and I mentioned a child because usually the person's under their care. It's typically a child, although it could also be a parent, an elderly parent who is infirm. So they might be going through dementia, and they might be kind of adding on here. They've got some other conditions and things, or it could be a spouse even. Again, they might be caretaking for their spouse in their older years, and again, producing these symptoms in them. All right, so last slide, differential diagnosis. So if I haven't introduced this term yet, let me introduce it here. So oftentimes doctors and psychologists, we're trying to differentiate between one disorder and another disorder. We call that differential diagnosis. And that's because it's often pretty difficult to discern and distinguish the two different disorders, two or more different disorders. So in terms of the somatic symptom disorders, and in particular, this factitious disorder, it's one of the ways you try to differentiate it is in regards to their willingness to discuss symptoms. So people with conversion disorder, and we aren't talking about that here, but conversion disorder is where they basically become convinced that they're paralyzed or blind, are kind of the most frequent versions of it, but there's no medical explanation of it. So in conversion disorder, they're not trying to produce these symptoms, at least not consciously. So they're very much willing to discuss them. And if you point out any inconsistencies, oh yeah, you're mostly paralyzed, but every once in a while I can see you move your leg. They're not going to get real defensive about that. They're going to be like, oh wow, yeah, that's interesting. They're going to just kind of be open about it. However, those who are malingering, or those who have factitious disorder, you point out inconsistencies, they're going to get super defensive. They're going to get maybe even angry at you and say, how dare you accuse me of lying? Or, they might say something like that. And so it's one of the ways you differentiate factitious disorder from the other disorders is from that reaction that they have when you propose any kind of inconsistency in their symptoms. Okay, so hopefully that was interesting and fun to learn about. I'll wrap up here, so I will bring it into it.